Hello. Welcome to this program now. I have a series of programs which is running for orthopedic conditions. I'm going to take it through a lot of patients over my experience of over 25, 30 years of orthopedic service with the training abroad in over 60 countries. And I want to just share my experience to all the patients so the patients benefit on their own without any major debacle. He can just treat on his own. I got trained abroad in many countries. Today is heel pain, plantar, which is such a common condition in the world. I've seen it abroad as well as India, everywhere. It's such a common condition it is. Let's go on to see some of the aspects of the plantar fasciitis. How does it present? Where does it come? What sort of persons get affected? Usually in sort of, middle-aged and younger age. Yes, of course. Even from 20 onwards it starts and goes on till 70. It's a wide spectrum of the age that it can present. Usually with the bad footwear. The footwear is not good. It's a rotten footwear. Then there can be something like even a costly footwear with the high heels, with the sharp heels, which is not going to help. And what sort of heel pain they get as soon as they get out from the chair? They're sitting in the computer for some time and getting out of the chair is painful. They're not able to even to step out. Not able to even to step further. It takes 5-10 minutes sometimes for them to get out, and the pain can be very sharp. And getting out of bed, people so suffer with pain. Earlier they come, better the recovery, sooner the recovery, and simpler the methods. Change of footwear is simple things, simple stretching exercises, cold compresses. These sort of things which can be done by any patient at home and get cured by himself, herself. Absolutely no problem. Now, as you leave it longer and longer, the pain gets worse and worse. And the pain can be really sharp. Sometimes patients with diabetes have this. There are patients who are coming with some sort of heel pain suddenly after a poking with a stone. Might be walking on a barefoot or a bad footwear and suddenly poked by a stone, and they can present acutely with pain. So what sort of pathology is there in sort of heel pain? What has been studied shows is microscopic tears on the plantar fascia, on the sharp, very thick tendon. It's just microscopic tears there, and that's what causes the problem. An X-ray sometimes shows, or many times shows, a spur. Or spur is an extra growth of the bone. That can happen, and that can give rise to pain. There are many patients with spurs without pain. That is okay, but a lot of patients which I see, they come with a spur, either a small one or a large one. Now, what we are getting to is only sort of heel pain, not the one which is above the heel, it's below the heel, around at the bottom of the foot. What sort of methods of treatment that can be done? Don't jump into things about surgery. It's not required at all. Majority do get better with some stretching, nice stretching exercises which we can teach you, which you can do it at home. Change of footwear. Very simple methods of changing the footwear. You don't have to go for fancy ones. All this costly and medical, unethical sort of, not aesthetical footwear. You don't need all that. Simple modification of footwear will sort out the issue. And what about the other treatments if it doesn't settle at all? Muscle strengthening, stretching is very important. And some people say don't walk. No, I'm just dead against that. You have to walk, but be sensible. When there is pain, you have to be sensible. You just walk as a limited sort of situation. Don't overdo it. But I don't say restrict yourself in bed or a chair. That's not the idea. Because there are many patients who improve with just one shot of injection. Just one injection. It will sort out the whole issue. The pain just goes away in 5 minutes. Patient comes here, gets an injection, 5 minutes, they just walk out comfortably, laughing and smiling. All the treacherous pain is just gone. There are times which is very rare that the patients may need surgery, but that's very, very rare. This injection will sort out the issue. Probably I've given thousands of injections on the foots. Okay, hardly any surgery is required. Thank you for watching on this program with the plantar fasciitis. We have a series of programs which is going on for the benefit of the patients. I'm from London Medical Bone and Joint. Thank you very much.